Well, hello there. Do we have an appointment today? I'm very happy to see you either way. Let me just check here and get you checked in. Name and date of birth, just to make sure I'm talking to the right person. Okay. I recognize you, of course, but, you could always be an imposter. You sometimes look very sus. I'm Jen. I'm an actual physician, and I'm really excited to go over stress with you and what kind of physical exam you might need for stress. Yeah. It is a little bit of an unusual thing. Sometimes it'll manifest. People will come to the doctor because they just have this non-specific back pain, or they just seem to have trouble sleeping, or they keep having regular headaches. It's rare for somebody like you to actually recognize, like, hey, I think I have a stress problem. Can we see what's going on in my entire body? So I commend you on that. Of course, we'll keep it a little quiet and secret because we're going to talk about things that, well, they're private and secret. The walls are thin, and I really don't want anybody to know your personal business. So we're going to be pretty quiet today. I know you can hear my emotional support birds in the other room. Yep. Well, because in addition to being an actual physician, I have actual illnesses myself. I've been under treatment for chronic pain, mental illness, so I kind of understand both sides of the coin a little bit. Yep. That's the honest truth. Now, another reason we're going to keep things real quiet is because, as you know, this is a secret meeting. In the real world, outside of this secret space, you and I have never met, and nothing is official medical advice to diagnose or treat any illness, because you and I have never had an individual consultation. Okay. I do individual telehealth consultations, but for now, yes, that would be healthcare.byjenfinelli.com. But for now, we're going to do our special stress consultation here in this secret place with no rules and nobody to mess up what we're trying to do, you and me. Okay? Well, I think we'll do a full physical exam. We'll go from top to bottom. I'll take a little bit of time listening to and looking at everything that's going on up here. Listen to the chest, kind of listen to your breathing, push on your belly a little bit. I kind of want to look at your skin a little bit, your fingernails, some other things like that. We'll check some pulses up, top, and bottom, and we'll probably do a little bit of a neurological exam, not the full thing. I do have a couple questions for you first, but go ahead and just tell me about your symptoms, and I'll type and listen. That way I won't ask you things that you were going to tell me anyway. Okay. I see. Yes, weight can be an issue. Any chronic illnesses? Okay. Do we need to update your family disease history at all? How about social history? You still living at home? You safe at home? Anybody forcing you to do anything physically or sexually that you don't want to do? Any threats or people making you feel especially afraid? Okay. All right. Well, those are just routine things I try to make sure to check for, because you never know. Sometimes people have interesting things going on. I'm not specifically targeting you to ask the question. It's just kind of routine. Got to make sure that people are okay. I was a sexual assault medical forensic examiner in the military, and saw a lot of stuff. And you'd always be surprised. Sometimes it's, sometimes it's men that have been dealing with abuse since they were little kids. Sometimes it's women. I've had a lot of LGBT folks having different abuse situations happen to them. People of faith. You never know. Sometimes it's who you least expect who's going through something. So, yeah. I see. Okay. How about work? Now, have you and I sat down and done the work questionnaire to kind of look at how your work is affecting your health and how, whether or not you need to switch up purpose and things like that? Okay. you know what I'm going to do? I'm going to leave a link to the work questionnaire below, and then you and I should do a follow-up for that. It's a private, kind of secret video, and you and I can look at that. I'll leave that below, and I'll also put it at the end of our visit. Okay. Because that can sometimes be a big source of stress. Are you having any eye pain, blurred vision, tunnel vision, or big white spots in your vision? Do you have throbbing headaches that aren't solved by Tylenol? Okay, or Excedrin. Have you tried Excedrin? Excedrin is this combination of acetaminophen, caffeine, and aspirin that just has an amazing effect on the blood vessels that can sometimes precipitate a migraine. That's my first line, like for somebody who starts getting auras or lights, or you start getting what you might think might be a migraine. Okay. Any particular headache location? If you have any, frontal, up here, back here? Okay. Okay. Any ear pain, ringing in your ears, difficulty hearing? Okay. Discharge? Okay. Runny nose, bloody nose? Okay. Cough, sore throat? Okay. Any chest pain, difficulty breathing when you lie down, difficulty breathing when you are walking? Okay. Any chest pain that gets worse when you start to walk or move or go up a flight of stairs, but immediately gets better when you rest? Yeah, those are red flag signs. Okay. Chest pain where you get some tightness after like running a mile, that's reasonable and normal, but where it's like pain when you walk and then stops when you stop, that's an alarm for coronary artery disease. Yeah. Do you ever get palpitations? Do you ever faint or pass out for no reason? Okay. Chest pain that hurts when you press on it. Okay. Do you get panic attacks? I also have a panic attack visit. Yeah. I won't link that, but it's pretty easy to find on my channel. Yeah. How about stomach pain? Any nausea, vomiting, diarrhea? Black stool, bloody stool, greasy stool that floats to the top of the toilet and it's covered in like a sheen and it's white. I know, a lot of poop questions. How hard is your poop usually? Do you get frequent abdominal cramping? Okay. How about any sudden muscle weakness? Do you ever have a limb like drop out from under you? No? Good. With your back pain, do you ever lose control of your bladder? I mean, like where you wet yourself and you had no idea that was going to happen. Foul, similar thing. Okay. And then joint pain. Okay. Any new rashes? Okay. Any desire to hurt yourself or others today? Okay. Not today. I also have a depression screening video, so you can check that out too. Let's start from the top to bottom. Excuse me. I'll listen to your heart in a second. While we're doing this exam, I thought I had a new thing I wanted to try today that you might find a little relaxing. Just as a side note. So let me wash my hands before I touch you, okay? Let me get my hand sanitizer here. Do you want some too? You can have some. Just squeeze it out of the bottle here and give some to you. Always make sure to rub your fingernails in the goo, because that's where a lot of dirt collects. When I used to help with surgeries and C-sections, we would get all up under there. And each individual finger, too. Yep, each finger. And up your forearm, too. All right. So, now we're good to touchy-touchy. I'm going to put gloves on top of what I've got. Sorry, just reaching behind you for these. Sorry. But it's never a bad idea to be doubly precautious, right? I don't think precautious is a word, is it? I'm actually a professional writer, professionally published. not even just self-published. So it's not good when I don't know words. I thought we'd put this on in the background. Do you get headaches caused by smell, or are soft, gentle smells in the background calming for you? Okay. This artificial lavender essential oil diffuser that I got from Tao Yang. They sent it to me for free as a gift for some of the work that I'm doing. And love life, love yourself. It's interesting. I have a slightly unique take on self-care, which is a little different than, I think sometimes what people are advertising as self-indulgence, like, oh, take care of yourself, go sit in the bathtub and eat a ton of ice cream, which I don't consider to be self-care. But my version of self-care is you take care of yourself, you clean and do good to the weapon that is your body so that you can help other people. So, but they have beautiful design here. It's a lovely little box. So I thought I'd put this on in the background when we have our physical exam. They have this, like, aroma diffusal model. They tell a manual, tell you what to do with it. Let me put that over here. And this purple box. It's got this little cord, so we'll plug that in. They said sometimes you have to turn the cord upside down. There's a particular batch of these models that were made that the cord needs to be plugged in upside down. That's what they told me in the email. And look at this. I think this looks really pretty. It's neat because unlike a standard diffuser, it looks... Look at that. It's so lovely. It's really well packaged. It looks like an actual flower pot, which I think is so lovely. And we've got this special foam packaging on it. Oh, that wasn't too loud, sorry. Put that over here. Look at that. It's a lovely little thing. And this is where you put the essential oils. I don't know if you can see the little nozzle, the color changing little nozzle I've got here, and it just plugs in like this. And now you have a little pot with your little diffuser. They've got a little button here for light, and a little button here for mist, which is really neat. And then you plug in your little cord right here, just like this. So that's what we're going to use today. I'm going to put that aside over here. I think it's going to be quite lovely. I'm excited about it. So I'm going to put that over here. I'm going to plug that in. Just down here next to you. Now, lavender is interesting. I did a little tea shop consultation with Intentional Attention ASMR, where we talked about lavender and the scientific evidence for ingested lavender. From the studies I could look at, there's no evidence for smelling lavender in causing anxiety or sleep to improve, but ingested lavender, yes. However, that doesn't mean that it's not nice and calming to have some aromatherapy in your house now and then. And some people, it makes them feel just so much happier to have, something like that. And this is something actually beautiful. So, anyway, so I'm packaging this one up again, but the one that I've plugged in next to you is going to release kind of this gentle scent. I get acupuncture from somebody sometimes, and they have lavender in all of their stuff. It's just a good calming scent, and it goes nicely with things like amethyst in your decoration style. So, anyway, we have that one plugged in next to you. Yes, I actually can get you a discount on them. I can try, yeah. Let me talk to them. Let me talk to the supplier, and we will see. We'll see what I can do for you. That's perfect. I will actually put a link so you can get one. They're also, it seems like an awesome gift. I'm going to give this extra one to probably to my mother-in-law, because I think she'll like it. All right, so now we've got the calming atmosphere set up. Let's start from head to toe, okay? First thing we're going to do here is I'm going to touch your scalp a little bit, if that's okay, okay? for here is signs of trauma, for nits or things in your hair, for things like hair loss. Sometimes people who feel like they're under immense stress have a thyroid disease, and sometimes dry hair can be an indication of a thyroid disease. So I'm just doing a little bit of a careful look here, just to make sure that all is well. Okay. Perfect. Okay. Then we can move down a little bit. Can I have you watch in your peripheral vision and see when you see my fingers? Okay. Alright, tell me when you see them. Okay. Pay attention to them. Okay. Very good. That's a good question. Yeah, because sometimes that's a thing. That's a thing that can absolutely happen. Let me have you go sit over on the table, and let me see about pulling up my eye chart, because I think, yeah, absolutely. And we won't do a huge in-depth eye test right now, but just go ahead and scan down the test. Stay right where you are. I'll hold the chart over here, and I'd like you to look down to as far as you can and read the lowest line that you can possibly read with both eyes open. Oh, are you in the 2015 club like I am? Okay, that's perfect. All right, let me have you let's go into the other room. It's got a little bit of a more calming light. I'll bring our little Taoyang lavender diffuser with us, and we'll do the rest of the physical exam in there. Okay? I like this room. It's the kind of nicest room. In this way, you can kind of lie down on the bed exactly where you are, and I can be a little bit over you. And that's kind of nice. Makes it a little easier to check you out. Make sure that everything is going okay. Any ringing or humming in your ears right now? Okay, just note here on my laptop here. Okay. Okay. If you close your eyes and turn your head from side to side, does that change the ringing in any way? If you have any? I also have an entire tinnitus visit that we can do. There's so many branching off points. Yeah. That's also easy to find. Okay. Can you hear this okay? Okay. Close your eyes and tell me when you first hear this sound in this ear and which ear you hear it in. Okay. And then the other side. So we say hearing and vision grossly intact. We're not doing our very in-depth test for those. We just do our quick screening. And then if we find problems, we go and do a repeat. So that's just fine. Let me go ahead and take a look in your eyes, okay? If you will humor me for a hot minute. Here, do you want this little snake guy? There you go. Just have to adjust the balance and focus here so that I can see good. It's pretty good. Okay. So just this eye right here. I'm going to put my hand here on your shoulder. Okay. What I'm doing here is I am looking to see your optic nerve, follow 4 blood vessels, try to follow each blood vessel east all the way. Kind of look same thing. I'm going to go ahead and put my hand on your shoulder on this side, okay? Okay, same thing. Optic nerve, trying to follow some blood vessels. Make sure you don't have any cotton wool spots. Looking for your fovea macula, all those good things. Okay. Alright. Turn that off. Actually, before I turn it off, can I have you just follow this light with your eyes? Okay. That is just fine. Alright. Let me take a look at your ears, okay? And I actually do want to take a little look in your nose. Yep. But before I do that, I have this little pouch where I store all my sensitive medical equipment. I got this kind of heavy-duty stuff because when I was working on my fellowship of advanced wilderness medicine and being in the military, I kind of got this idea that I didn't want... in medical school, I had a really soft little Welsh Allen kit that was just not solid enough, and that I feel like was just going to break no matter what I did. So, and then for the environment, I have these like sterilizable, reusable ones, tips, which is kind of nice because there's so much plastic that can't be sterilized and just gets disgusting, and then you just have to throw it away. So I'm going to look in this ear. But before I look in this ear, I'm going to put my finger here and pull down on your eye. I want to look for signs of anemia underneath your eyelid. Okay? So just kind of pull down. Can you look up for me? Great. Other side, right here. So we did here, down, and over here, down. Okay. And follow my fingers. The doctor blessing. Not to be sacrilegious, but right. Let's take a look in your ear, okay? So what I'm looking for here is making sure there's no erythema, no edema. In your case, I am not just looking for a bulging tympanic membrane, but I'm also looking to see if we have any kind of flaking or excoriation, because sometimes when we have allergies and stress and a lot of histamine buildup, we can have irritation in our ears. Cerumen impaction, too, is another thing. I do have an ear cleaning visit also that you can go see. Professional ear cleaning with a real doctor. Alright, so same thing in this other ear. And you're going to kind of feel me just like pulling a little. Actually, back over here, there's something I wanted to check. So you're going to hear me kind of just pulling back your ear a little bit so I can see. Let me know if you have any discomfort. Okay. Over here, same kind of thing. I'm just going to kind of gently pull here and looking for erythema, edema, tympanic membrane, bulging, leakage. Some people have scar tissue on their tympanic membrane from many ear infections when they were a baby. I had a soldier once who had a big hole where his tympanic membrane was supposed to be because that morning in the shower he had stuck a pencil in his ear and he heard a loud pop. That's not a good thing. Yeah. So don't do that. Don't stick things in your ear. I think it was a Q-tip, not a pencil. But I know ears can be really irritating. I have a tendency to want to scratch mine out too. But the better solution is to get eardrops. Carbamide, carbamyl peroxide can be helpful. Some people use hydrogen peroxide, which is stronger, but also safe. The issue that I find is sometimes my cerumen will impact and cover the tympanic membrane. And then when I wash it, it'll, with carbamide peroxide or something, it'll become this thin layer that's impossible to get out. So if you do use that, then use a pipette to then squeeze water in your ear and suction it back out. Just one of those little bulbs, and that can help make a difference. Or go get a professional cleaning with a little curette, things like that. Okay. Oh, Or get an allergy prescription, because sometimes you have allergies and that's why your ears are so bothersome. Alright. And stress can do those things. The big things I'm looking for, though, that I want to pay attention to are going to be the cardiac things. Oh, because we're doing the allergies thing, I want to look in your nose, too. Let me get a new one of these. Nice little glimpse up your nose, okay? What I'm looking for here is swollen nasal turbinates, erythema, edema, those kind of things. Okay. While I'm listening to your heart, can I have you put this on your finger? This little thing. It's your pulse saturometer. Just have you clip that to your little finger, okay? You can hear a little beep. Okay. And I think my nurse already got my medic actually got your blood pressure when you came in, right? Rock on. And your weight, too. Can you hold this little guy for me? Okay. Let's listen to your heart. So for this heart exam, I'm going to listen with the front end, the diaphragm, and the bell for different things. The bell is better for hearing bruits and hearing sounds like beats. And the diaphragm helps you hear sometimes sounds that are in between the two beats. So different kinds of murmurs. But you listen with both because there's different sounds you hear better with both. So I'm going to listen first here over the aortic spot. And you're totally fine right where you are, a little bit leaned back. I'll have you lean forward after. And then over here, sorry, pulmonic spot, aortic spot. The other way around. Right here. Anything bad, I just want to make sure I'm notating as we go along. Okay, here. And here. And then the tricuspid spot, which is down near your left lower sternum border. And then, can I have you lift your left breast a little bit? Men have breasts too. Women have breasts. All kinds of people have breasts. I mean your pec. If you prefer, I can say that. You can lift up your pec. Just kind of move it a little bit on the side. Sometimes people who are very muscular or women with pendulous breasts is a little bit harder to hear right here. And then I'm going to listen on the side here, right here. Okay. Now, can I have you lean forward a little bit? Just kind of lean forward. And I'm going to listen here. Okay. Turning around, listening with the bell. Same thing. Same thing. Excellent. Okay. And then with the bell, I want to listen to your carotids also, okay? Over here and over here. Okay. All right. I'd like to listen with the bell to the middle of your belly. Listen to your aorta, okay? Yep, you have an aortic spot up here on your chest, and then you have another important spot in the center of your belly. I'm just going to take a listen there. Okay. Now, can I feel the pulses in your wrist? Okay. And then, yeah, I'm just sticking my fingers in the top of your shoes. I just want to feel on the top of your feet right there. Okay. All right, let me listen to your lungs, and actually while I'm here in the front, let me listen to your belly first, okay? I'll listen to the normal part of your belly. Just listening for happy gurgles. And over here. And over here. And over here. Great. I'm going to press on your belly. I'm going to tap on it first. Here, I'm just measuring your liver a little bit. I'm going to push my hand in here. Can you take a deep breath? Okay. I'm going to push down here and release my hand quickly. Okay. And then back here, I'm just going to squeeze your side right here. I'm looking for your spleen. Deep breath in and out. Okay. I'm going to kind of pull your knee up here. Okay, and then back with your knee. Okay. I'm going to tap on your leg here. Just looking for peritoneal signs. If you ever find it where tapping your leg or jumping causes your belly to have excruciating pain, go to the ER. That's an appendicitis sign. Yep. It's if you tap or jump and then all of a sudden it's like shooting pain. That's an ER visit. Yep, especially if you also have a fever. Let me listen to your back now. I'd like to hear your lungs. I'm going to listen up here in the apices first. Up here in the top. Okay, deep breath. That's right up here. It's important to listen to the top of your lungs. Sometimes that's where pneumonia starts. Deep breath here. Take a deep breath in. All right. I want to talk about your breathing a little bit, actually. Do you do any mind-body work? I know that sounds very woo-woo, but it actually isn't. Lay your hands on your belly for me. Okay, take a deep breath in and out. Do you feel like you're getting taller or like you move your chest when you breathe? I'd like you to try and see if you can focus on pushing your belly out when you breathe. When you breathe in, stretch your belly out, and that makes room for your diaphragm to be able to come down and bring your lungs in and get a better sense of air. That's because we want to trigger some of the nerves that are down in the lower part of your belly. Your vagus nerve goes all the way down here. And when you're breathing with your belly, where you're having, that's where your digestion happens, that's where things that are calm are supposed to happen. It stimulates that nerve to help calm down your whole parasympathetic, to use your parasympathetic nervous system to help you calm down, right? When you're breathing with your chest, that's up where your heart is, that's where things are going a little faster. It's your body starts to activate your accessory muscles that help you breathe for emergencies. So if you're breathing with some of your emergency muscles all the time, your body can feel like, hey, I'm under an emergency. That's with your sympathetic nervous system, which is for emergencies. Parasympathetic is for when you're calm, right? So you can help trigger your body to understand, hey, we're in a moment of calm by breathing out with your belly and trying to, trigger and stimulate that vagus nerve. So if you get used to breathing that way, that can be helpful. So put your hand on your belly, just put your hand on your belly, and I want you to lift your hands forward when you breathe in and push in to get the air out. You can squeeze your belly like you're a toothpaste, okay? Breathe in and out. And out. And there's a special kind of warm breathing called ujjayi breathing, where instead of just your normal breath, this is a little advanced, you can do it. Instead of just breathing, you always just breathe in your nose, not your mouth. You breathe in your nose and you make a humming, almost like grudge sound. It's ocean breathing. You're going to warm your breath. Like, you know how when you're warming your hands on a cool day, you and there's this like extra fire, right, that you bring up from your throat. You don't just blow like when you're trying to cool something down. It's like your breath. I'd like you to breathe your breath inside. So like this. Hear that sound? It's like I'm going to blow hot air out my mouth, but I'm keeping it in. It's also like I'm snoring. A little bit like that. You just want to fill the whole area. So try doing that with your tummy. You're warming this cooking pot. It's your belly, right? Another thing that can help your body realize you're not in fight or flight and that you can have a calmer moment is to actually slow down your breathing consciously, right? We hyperventilate when we are scared. So you can actually tell your body you're scared by hyperventilating, or your body can tell you it's scared by hyperventilating. So if you do this warm ujjayi breathing really slow, 3 or 4 in, 3 or 4 out. I can actually link a handout below for you to use. Yeah, if you like. I'll do that. Let me make a note of that. Let me make a little note. I need to make sure to give you the handout. You needed the aromatherapy diffuser. I'm going to give you all kinds of goodies today. So the handout for breathing. And you know what else I'd like to do? I'd actually like to get you an in-depth tea consultation. That may sound a little silly. Here's the situation with that. When I had my big crash at the end of my deployment in Korea, there was one day where I was out with my husband drinking tea. And for the first time in a long time, I realized that I felt a little bit okay. Now, I'm not going to say that tea can cure all of your ailments, but it can certainly help to give your body a rest from some of the sugary toxins that are making it exhausted and stressed. And it can also help give your mind a rest, because there are certain chemicals in tea that are good and calming for the mind. And I've got a bunch of studies on those that I can send you if you like. And so I'd like to take you through this special little consultation. So 2 things. One, I'd actually like to get you into my program where I can send you weekly, science of relaxation. Yeah, because we have to understand stress in order to really be able to fight it and its effects on our body, right? Stress is a chemical thing, right? And these chemical things can happen because you are, have cortisol up all the time. Cortisol is supposed to help you and help your immune system, right after when you're in a starvation situation, or when you're in a disease situation, or when you're being chased by a lion or something like that. But If you have cortisol up all the time, it wears on all of your body's tissues. You can start getting aches and pains. You get more lactic acidosis. All kinds of things can happen in your body with a lot of these chronic stressors. And that can be food. The foods you're eating can be worsening the stress on your tissues, and that can also affect your emotional health, actually, because the whole thing is connected. You don't have some separate floaty thing. Everything is connected in your body, right? People, when they taught us in high school that we're just bags of chemicals and therefore meaningless, and therefore we have no soul, that was what I was taught in high school anyway, they don't realize that we are beautiful bags of chemicals, and these are our soul. In medical school, I learned the biopsychosocial model of care, right? Where we don't just look at somebody as a liver disease. We look at somebody as a whole person. What are the social factors causing that person to drink and have liver disease, right? Are they stressed from a trauma they had as a child? So if I want to fix this liver, do I have to deal with that first, right? What are the factors that are going on in their life around them? Do they have a good or bad support system? What are the other biological things going on? What are they eating that is making them feel like they have a need for alcohol? What else is going on? Yes, we have to focus on the liver, but your whole person, right? And it's the same with any kind of stress. Everything is connected. We are bags of chemicals, but we are beautiful bags of chemicals. And each chemical is so important in helping make up who we are. And we're, the world's only real self-programming and self-healing computers that can repair itself. And we're quite precious things. I have found the more science I learn, the more I believe in this beautiful divine that made us, and the more evolutionary science I learn, like actually proven evolutionary science, the more I believe in this, beauty that you are, and that was, designed to be absolutely special. So, when we're thinking of these different models, instead of thinking of you as, an accident bag of chemicals, I think of you as this unique being that through all of time, right, all the different factors that happened to your ancestors have coalesced in this moment to make you, who will only exist at this one period of time right now. You will not exist at some other time period. You are here right now. And this genetics and this being that you are in this particular arrangement of chemicals has never been seen before. And that's so precious. That the kind of random chance that would be required to make you is astronomical. And here you are. You're special and you're here for a reason. And so when I invite you to join me in understanding the science of relaxation, what I'm really inviting you to do is thinking about your purpose. How can you better take care of this body that you are so that you can make, the most of this special being that you are? So anyway, that's my little silly spiel, but all of the stuff that you are, all these chemicals, is influenced by all kinds of things, by what you eat. And so I try to help you find things that are good to get in your body, to get in your mind, and just these moments to help you better cope with the world around you. I'm not going to say that a tea is going to cure cancer. I'm never going to say something like that. But unless there's enough scientific evidence for it, in which case then I will say it. But I will say to you that there are certain chemicals and certain herbs that can help you. And so you can do an individualized consultation with me. tinglestea.byjenfinelli.com I have a little AI that can walk you through some consultation with a tea-style quiz. But don't get caught up only in that quiz. Before you finish your quiz, and this is real and serious, before you finish your quiz, go to the bottom of that front page, tinglestea.byjenfinelli.com, and make sure you sign up for my special relaxation club. Okay? I'm also going to put the link below for you so that you can join my tea time with dragons, is what I call it. Okay? I'll make sure to include that too. You are invited. And that way, we can stay in touch. Even if I disappear off of YouTube, I can still make sure you get the science and the studies that are actually going to benefit you in the long run. So please make sure you're doing that, okay? So that's something. The other thing I can do for you to kind of help with some of the stuff that we've found out right from this physical exam and some of these questions that we've asked, the other thing I can do for you to help you reduce stress is I can actually send you every month a box of wellness. Yes, this is in real life. I've put together some evidence-based relaxation exercises from cognitive behavioral therapy, dialectical behavioral therapy, different techniques that I have gone through myself as a patient, and also that I've learned as a physician when I was credentialed for primary behavioral health care in the military, the hospital I used to work at. So I can send you every month a little tea, and we can choose the tea based on that little AI to help figure out what's the best one for you and your needs. Because some people have chemical stress because they've got diabetes, right? So then we look into things like, can we use a cream Earl Grey with no sugar in it to replace some of your sugary teas, but still say your sugary drinks, but still taste sweet? So other people have, cognitive stress. Can we get you a green tea to help you with that? Other people have some anxiety or some difficulty sleeping. There are a couple studies on lavender. So, what can we do, right, to help make your life best? So we can do that AI, and we can pick you a monthly tea and a monthly relaxation exercise that's for you and me to do together. And then in your third month, we can have an actual live consultation where you and I sit down and go through what are the best changes you can make to best optimize your response to stress. And you can bring me any kind of herbal questions you might have too. Does that sound good? Cost is a big question. I make sure to source my stuff ethically, which means I want to pay tea workers fairly. We source teas that are, some award-winning blends from all around the world. And I want to make sure that when we're doing that, we're sourcing directly from some of the most ancient fields in the world, in Japan and China and Kenya, India, Sri Lanka, just some very special tea places, right? We want to make sure we're doing it ethically, because my business model is you getting help should also help somebody else. If I'm helped by you buying into my business, the help should be mutual. Everyone along the chain should be helped, and you should be helped. This is what I call, I had a special term for it, but I forgot my term. It was something like precocious capitalism, or it wasn't ethical capitalism, but it's basically this beautiful system in which everything we do helps everybody else along the line. So when it comes to cost, despite that, despite the fact that quality is so important to me and making sure that everybody gets care and shipping isn't rushed, right? So we're not abusing shipping workers, despite all that, I also want costs to be kind of reasonable, so I make sure to try to price it out so that the thing plus shipping is always going to be less than what you would pay for that equivalent number of cups of fancy tea at Starbucks or at a fancy coffee shop. So, and we can pick it and tweak it and find the best thing. And I honestly believe that's helpful for stress. I believe that because I've been under some of the most intense stresses that are possible. I was a sexual assault medical forensic examiner. I have seen some horrible deaths. I have seen some horrible abuses, and I have been in a position where I broke down because I had a lot of trauma as a child where my siblings' lives were often in danger. So I was a hypervigilant person already going into medical school in the military. And I know what it's like to not be able to handle even the slightest things like going outside. I know what it's like to have stress overwhelm and take over your life and affect your body, right? So that I have chronic pain that I'm still healing from. And I'd like to prevent you from falling into that kind of mess that I fell into, because now I have to claw my way back out of it with these intense treatments. I'd like instead to start with, while the stress is manageable, and fix it. And even if you're in the bad situation where I am, I'd like to give you those little quiet moments every month so that you can start calming and experiencing a tiny bit of happiness and calm amidst all of the storm. That's why it's called Tea Time with Dragons. So, the monthly box of rest also comes with the Wellness Project, which is where I have gathered a bunch of resources that I found through the military and other places, and what you're paying for with the Wellness Project is basically kind of a group, like think tank to help you create a project out of your own life and figure out how to keep your goals so you can kind of individualize it. So you can pick and choose from these resources that I've found. It's not selling you the resources, because the resources themselves, it's science and it's knowledge that anybody, I think, can access, and a lot of these things are public domain. But the problem is a lot of people don't know how to find them. So I've done the work of finding everything for you, like $5,000 worth of work, right? Because, physician time that has been spent in gathering these things, and I've put them together so that you can find them. That's really what you're getting. So that, consultation, all this good stuff, every month you can get the good things. I also have a way that you can get the Wellness Project for pay what you want or free, separate from the monthly box of rest. But I highly encourage you to check out the monthly box of rest, okay? Because it's kind of my best little present for you. tinglestea.byjenfinelli.com. You can click on monthly box of rest up at the top. This matters to me. This is kind of the culmination of why I started doing ASMR to begin with, because I felt like there was a need within this niche for real scientific information and for your help to help others, for you to get help in such a way that it funds projects that make a difference for other people, right? If you getting help allows me not just to be good to tea workers, but also to put stuff away for myself so I can take care of myself and continue to help other people, and so that I can take proceeds and give to anti-human trafficking organizations, or like my friend's orphanage in Liberia, you, through this model, you getting help helps me help them, and we're all connected. And that's so important to me, and I think that in some ways that's what the ASMR community should be about, right? We take these moments of peace and calm. No one's saying that ASMR will cure your cancer or cure your anxiety or depression, or they shouldn't be saying that. If they are, they're lying to you. But it can give you these moments of rest and connection with other people that can help you also be connected with yourself and the world around you. And that way, we start to build a better place, build some healing, and it leaves room where you can start thinking, I want to take care of. So I do the work to find resources for you to help yourself have effective scientific self-care, because I want you not to have to do that. I want you not to have to be hunting so hard, so that you can hunt for the more important things, like why are you here in the universe, and is there God, and what is your relationship with your fellow people, and the big things in life. How do you make the most of the time you have before you die? Because we're all going to die. I want you to be able to tackle those big issues so that you can handle life when it throws the worst things at you. And I don't think that you can really do that if you have so much stress that your mind can't focus and your body is all over the place, and diabetes is eating up your peripheral blood vessels and your fingers and your toes and your genitalia and all the things that get hurt by chronic sugar stress, hypertension, and things like that, right? I think that makes it really hard to focus on being what you're meant to be. So I want to take away some of the distractions and give you a moment of rest so that you can start being who you are supposed to be. So that's what I've got for you. Definitely. So the breathing handout, I will link below to make sure you have that. I always try to give you something. I want my free stuff that I give you to be better than other people's paid stuff. I will link also the aromatherapy diffuser below just for fun. The Tea Time with Dragons email list, also free, just for fun, because I think, not just for fun, but because I seriously think that can help improve your relaxation. And then the monthly box of rest, which is not free because I can't just steal tea from people, but that also, all the other stuff is free. So I'll link all that below, okay? I think we can start to get a handle on your stress when we start figuring out what your goals are. That's why the Wellness Project is so important to me. Oh, and one more thing, I also wanted to link to that visit about how your work is affecting your stress. Yeah, let's do that next. Yes. We'll make sure to do that. So there'll be a secret link for that. Okay. Any questions for me? I believe in you. I know what you're supposed to be. And I'm really glad that you spent this time with me. I know you probably started in here just to get a little bit of personal attention, a couple of triggers taken care of, but I want this to be something more, and I hope that this surprised you, and maybe a little bit of change was made. Yeah. Let's move on to the